What we're going to talk about today is mistletoe. Here we've got mistletoe living off a tree, and there we have cancer living out of the person and off the person. Traditionally they would have gone, yeah, it's doing the same thing. Cancer growths were there. People were covering cancer growths. They weren't removing them traditionally, and they knew they'd die from them. But the mistletoe would be taken as a herb of choice because, like that cancer is growing, so the mistletoe is growing on the person as well as that parasitic way of being. I'm sure you could kiss under the mistletoe outside of Christmas time as well if you happen to see it. I'm sure it's not just reserved for a Christmas kiss. Hello and welcome. Mentoring with Geraldine is a bite-sized practitioner podcast for naturopaths, nutritionists, herbalists and practitioners. This podcast responds directly to your needs, the needs of the practicing natural therapist. With interviews, herbal discussions, something business and something clinical each week, you'll get the variety you need and enjoy to stay motivated in practice. Hello, everybody, and welcome again to Mentoring with Geraldine and the Bite-Sized Podcast. And today I've got the wonderful Christine from the Herbal Extract Company in Sydney. And what we're going to talk about today is mistletoe. And I do want to put a little bit of a disclaimer on the front of our conversation today, and that if you are a member of the public, please see a naturopath or herbalist, as I don't personally believe that mistletoe should be taken as a single. And you do need to be under the supervision of someone who specializes in cancers and serious illness that mistletoe has been suggested for within the literature. So just make sure, if you are a member of the public, that you do have a naturopath or herbalist and you don't just go and seek out this herb independently. Okay. So because this is only a quick discussion, whereas those of us who are practitioners who are listening, it's a great reminder about mistletoe and how we can use it. I do have some on my shelf as a liquid tincture from the Herbal Extract Company, and I don't use it very often. And when I do use it in quite low dose. So please tell us about it, Christine.
Yes, well, and one of the reasons we chose this as well was because it's Christmas.
Yes.
Mistletoe is famous for, it's romantically associated with stealing a kiss at Christmas when you stand under it. So that's one of the reasons why we were talking about it. But, as you said, it's frequently used in complementary therapy as an adjuvant in cancer treatment. So adjuvant being along with other treatment. It's not the sole treatment. And other immunological disorders. There is some, several lines of evidence that it can improve patient survival in cancer. There's no specific cancers there, and also the damage caused by the conventional therapies, and that it also increases the patient's quality of life. So it is exciting to have a tool like this. And we have preclinical evidence, experimental models that, to justify those claims.
Yes.
But there would need to be more. Cancer's tricky, obviously. It's so many variables. But we do have some, anti-cancer evidence preclinically to show that it's very high in antioxidants, which is always going to be good.
Yeah. The autoimmune and inflammatory conditions. So, it is quite a low dose here, but you've got some randomized controlled trials, which is the gold standard, which is what we want to be seeking out and looking for. And so having these trials in the background means that we do have some data and some evidence to use it as an adjunct to our cancer therapies. So besides the cancer therapies, to complement the cancer therapies and recovery. So
as a doctor, a practitioner would be using this under, with a doctor as well, or with many different practitioners that the patient is dealing with.
Yeah, absolutely. So the other thing about it is the antihypertensive effect as well. That's where I've tended to use it. I don't work with cancer clients. I think that's very much a specialty because of all of the medications and the drugs and everything else. So it is, there are naturopaths who have it as a specialist area and they're using it. But I've used it as an antihypertensive as part of a combined mix. Again, never as a single. So can you tell us a bit about its vasodilator effects?
Yes, well, that was discovered, some of these herbs have great sort of early discoveries by, physicians, and this was a French guy called René Gaultier in 1907. He recorded its use as a vasodilator, and there was a commercially available preparation in the 1930s to 50s, and it's just sort of re-emerged as an antihypertensive. And I don't have any clinical trials here, but there is test tube evidence that can decrease blood pressure without causing a change in heart rate. And so it showed, there is a pilot study, I should say, but it's showing promise.
Yes.
The scientific evidence is showing promise in its use in hypertension and arteriosclerosis and cardiovascular disorders. Mistletoe is a Celtic name which means all heal. It has been used in traditional medicine in Europe centuries to treat diseases like cancer, cardiovascular disorder, hypertension, arthritis. It's been used for a long time and is obviously across the board because it's got the name all heal.
Yeah, absolutely. It is a parasitic plant, so it grows on other plants, which is why, you'd steal that kiss under any tree that happened to have mistletoe growing in it. So when a plant has that parasitic effect, so when we talk about forgotten the word now, when our herb looks like something, so like in foods, your walnut is very good for the brain, and of course it looks like a little brain. So we have that, so here we've got mistletoe living off a tree, and there we have cancer living out of the person and off the person. So where, traditionally they would have gone, it's doing the same thing. This, cancer growths were there. People were covering cancer growths. They weren't removing them traditionally, and they knew they'd die from them. But the mistletoe would be taken as a herb of choice because like that cancer is growing, so the mistletoe is growing on the person as well as that parasitic way of being, I guess. So and it grows on all sorts of trees as well. So pine, poplar, oak, apple trees. So when it's growing on a tree that produces fruit as well, it's taking that nutrient, but the tree still grows the fruit, even though it has mistletoe.
Because there's a study there that the phytochemical profile of mistletoe will depend on the host plant.
Wow.
So because it's semi-parasitic, so the compounds obviously that are in it are going to be affected by the tree that it's growing on. So there's not a lot of literature on that. They're starting to look into it, I guess, to see what compounds what compounds are passing from the host tree to the mistletoe as well.
Yeah. Which is really interesting because that might have a significant change to which one it's used for. Whether you're taking your mistletoe off an apple tree or you're taking your mistletoe off pine. Because we do know, of course, that pine is very high in antioxidants. So it's going to have a very different makeup, that mistletoe, that's come from a pine tree, that's come from an apple tree, for example. A phenomenal, very Christmassy herb, but with quite, a couple of very almost specific uses, even though it's a heal-all for the worst problems, really degenerative and the real problems. It's not for your coughs and your colds, it's for when we're really truly unwell. So because of all that antioxidant, cytotoxic and anti-tumor, so immunomodulatory, so it's got a lot of actives and a lot of uses. It's a phenomenal herb. So there are a couple of contraindications, of course. It's not to be used in pregnancy, for example, but we don't know about drug interactions, so there's none known at the moment. But that's something that, as they do more and more work with the herb as an adjunct to cancer and to cancer therapy, that's where they will start making those discoveries. So it's really a plant to keep an eye on, isn't it? It's one of those, and it's an amazing herb. It's the TNFA alpha activity to strengthen the immune system to combat cancer as well. So it's really got a bit of science we do like for something that's been around for so long. We've got a lot of traditional knowledge on it as well as people researching it constantly. I mean, that physician you spoke about, that was 1907.
Yeah.
So we've got this.
Exactly.
Yeah, we've got this constant use, this constant understanding and learning. This is one of those herbs that people are always showing interest in and seeing what they can learn from it.
And I think with cancer patients too, it's this quality of life. If you can improve the quality of life and the damage that's caused by the conventional cancer therapies, as well as including improving survival rates.
Yeah.
That's got to be something that's worthwhile looking into, isn't it?
It's really big. I mean, that's part and parcel of being a naturopath and a herbalist, is making sure that someone's, they've got that quality of life, and the clients that they're seeing are able, because because I want everyone who happens upon this podcast to find themselves a naturopath that's preferably local to them. And if they don't have one local, then certainly to find one within their own country so that they can, it's great to get the knowledge from someone overseas, but you can't necessarily always access the same products. So I do feel that, people all need to have a naturopath and a nutritionist, a herbalist as part of their healthcare team for themselves as they get older. So it's really quite essential. So that's.
Oh, sorry, I was just going to say, in one of the highlights I did, I think looking at mistletoe as well, not only I think this is from preclinical evidence, but it seems to not only modulate the immune system, but directly be cytotoxic to cancer cells without affecting normal healthy cells. So, yeah, I mean, that's a thing. They think that's where its anti-cancer activity is coming from. And obviously antioxidants offer protection as well. So, it's an all-rounder, really.
It is an all-rounder because that's not, often because there's all this, kill the cancer cells, but you are killing all the good cells around it and you're reducing that immunity. So here we've got something that's going to be this great adjunct and it's working only where it's meant to because of its, how it's parasitic, because of who it is as a herb and, what it does as a herb. It's going in for where it needs to be. So it's really one of the herbs because, lots of herbs, like lots of drugs, cover a lot of things and can change a lot of things. And here's one that's it's targeted. So it's very interesting. And the future research on this one is going to be phenomenal. It's going to be amazing. So we just have to keep it in everybody's vision as, a herb to be looking at and using. And it's been used like that for years. So it's not suddenly a modern usage for this herb. It's very much a traditional usage for this herb that we're finding the science for. Right. Have we got anything else that we've missed about this good old mistletoe?
Remind everyone to steal a kiss when they see the mistletoe.
Yep, get on there and steal that kiss, everybody. Make sure that I'm sure you could kiss under the mistletoe outside of Christmas time as well if you happen to see it. I'm sure it's not just reserved for a Christmas kiss.
Although, we do have to ask for the kiss, don't we?
We do. We should always
ask. About stealing the kiss without consent, but you must have consent when you steal that kiss.
100%. All right. Well, thank you very much again, Christine. And I look forward to when we chat next time and we will have another set of exciting herbs to talk about. And thank you again.
My pleasure. Talk to you
Cheers.
Bye.
Thanks so much for joining me today. Don't forget to rate, review, and subscribe to the podcast for the weekly episodes. If you'd like even more support and learning, then the Academy is for you. Here you'll find part 2 of the herbal discussions, more clinical learning, and case studies to support your clients in practice. Bye for now.